You might be in your 70s, 80s, or even 90s, and you've been active your whole life, but not formally exercised. You've heard all about the benefits of exercise, but you're wondering, is it too late for you? That's exactly what we're going to cover in this video. First of all, let me give you a quick case study. I'm a personal trainer, and I have one client who is 84 years old. He's a grandpa, and like you, he's been active his whole life. In general, he's been active just doing general housework, gardening, stuff like that. But over the last 30 years, before he started to work with me, he was an active gym goer, but not necessarily doing everything right. He'd walk in the gym, he wouldn't have a set program, so he'd just look around, see which equipment was free, jump on that machine. Wasn't sure if he was doing it in the right order, using the right weights, number of repetitions, resting the right amount, etc. After designing a program for him, he was actually able to gain 6 pounds of muscle and triple his strength in certain exercises in a matter of about 6 months. So quite fast because he used the right approach. And again, he's 84 years old. The message is, yes, it can absolutely be done no matter what your age is. In fact, the greatest benefits from exercise come to seniors. The more out of shape you are, the greater the benefits of exercise. To somebody who's already fit and wants to get fitter, the benefits are actually pretty minimal, pretty minute. If somebody can already bench press 200 and they can now bench 210, does that really improve their life? Does anything in their life change? Not really. But if you were so weak, you were having difficulty getting out of your chair or getting up the stairs, and you go from really weak to just average, if you bridge that gap, your life will be dramatically different. First of all, you've extended your health span. You might not be able to extend your lifespan, but the amount of good years in your life has really improved. Second of all, you will not need to be dependent on others around you to do simple activities like dress yourself, shower, open jars, get off the toilet, etc. Also, it opens up a lot of travel options. If you're unhealthy and unfit, maybe your only travel option is to sit on the beach and do nothing. But if you're more active, if you're stronger, leaner, and you have better endurance, it opens up a lot of travel options. You want to go hiking, you can do that. You want to walk around the city, you can do that as well. So it opens up a whole set of options for you if you're just as fit as average. Not even super fit, just average. With that said, I wanna change your paradigm with something. You're never too old to exercise, but you could be too old to not exercise. Somebody who's young can get away without exercising because they have, here's the strength that their daily activities require, but here's their strength level. As you get older, the strength needed to do your activities stays the same, but your actual strength declines to the point where it might just match, and at some point it'll be even below what you need to do. So if you're old, you can't afford to let this decline happen. If you're young, you can afford to go from here to here. Your life will be no different. Your wife might be different, but your life will be no different. So if you're generally active but not exercising, hopefully by now I've convinced you to start exercising. Where do you start? Well, again, if you've never exercised before, or at least you haven't done so in the last year, talk to your doctor first, because I don't know you. I don't know what health conditions you have, what injuries you might have, what medications you might be taking, etc. Talk to your doctor so you can get personalized advice about whether or not you can exercise. Don't ask for your doctor for advice on what to do, that's not their expertise, but just ask them, are you clear for exercise? Are there any limits on what you can do? Can you not take your pulse to a certain level? Should you not strain past a certain weight? But just ask them, are you clear to exercise? Now, of course, you haven't asked your doctor about what to do, you just asked them, can you do it? For the what to do part, you actually have to speak to an exercise professional, not a medical professional. That exercise professional is usually a personal trainer, but make sure it's a good, competent personal trainer who understands training seniors, which is a little bit different, not a lot different, but a little bit different than training younger people. After that, start slow. You don't want to go as hard as you can the first day so you get injured, burned out, and your muscles are extremely sore and you never want to do this again. Start slow. Start with less than you think you can. If you think that your first workout is easy, that's good. Even though it's easy, stop short. If you were planning to go for an hour, if you were planning to do 3 sets, stop at 1 or 2 sets. Don't do any more than the very bare minimum, because again, initially, the goal is not perfection. The goal is not effectiveness. The goal is just compliance, just to get good positive momentum going so that after you have at least 3 months of consistent exercise experience, then you can start worrying about effectiveness. Until then, worry about consistency and compliance. Finally, you want to balance safety and effectiveness. You want both. A lot of seniors are too concerned with safety and not concerned enough with effectiveness. They're afraid to lift a heavier weight than they can handle because they think it's going to injure them. If you're already able to do 60 pounds and you go to 70, it's not going to injure you. If you can't do it, you just can't do it. Or you might not be able to do as many repetitions. It's not going to injure you. So you have to, yes, safety is important, but don't sacrifice effectiveness for safety. You can have both. It doesn't have to be one or the other. You can have both. And from the effectiveness perspective, what makes exercise effective is not just the exercise selection. Yes, that's important, but it's not the most important variable. The most important variable is your progression model. In other words, your mindset should be, what can I do slightly more difficult than last time? Can I add 1 repetition? Can I add 1 pound? Can I improve my range of motion? Can I shorten my rest periods? These are all examples of different methods of progression. But every workout, strive to make something ever so slightly different and slightly more difficult than the workout before that. After all, as your body changes, so should your workout. It's not like one day, your first day, you figured out, okay, this is the right weight for me, and that's the right weight for me forever. This is just the right weight for you right now. That might not be the right weight for you in 2 or 3 workouts. Then you'll need a heavier weight as you get stronger. And initially, you're going to get stronger pretty fast. Your first 3 to 6 months of exercise, you're going to see dramatic progress. It's going to be the best progress of your life, because the more advanced you get, the less progress you can make. The more and more you have to work for less and less and less progress. But initially, don't be shy about raising your weights aggressively. Now, if you are shy about raising your weights aggressively and you're not sure if you're doing it properly, you're not sure if you're raising the weights too aggressively, and you want professional help, we offer online personal training for seniors. That's our specialty. If you click on the link in the description below, it'll take you to our homepage where you can fill out a simple application form that'll take you to a 10 to 15 minute Zoom chat with us, which is no pressure, no obligation, no sales pitch, just to see whether or not we can help you. So now that I've convinced you that you can't afford to not exercise, what are the best strength training exercises to do? The best strength training exercises meet a number of criteria. In no particular order, one criterion is that they're safe. Another criterion is that with one exercise, you cover several muscle groups. For example, if you're going to do a push-up, it works the muscles of the front of the chest, the front of the shoulder, and the back of the arm. If you were to do 3 separate exercises for each individual muscle, it would take you triple the time. You don't want to spend triple the time in the gym. Another criterion is that it's easy to learn. You don't need to spend, a university degree in order to figure out what these exercises are. And a fourth criterion is that they are easy to do no matter what setting. You don't need specialized equipment to do them. So what are these exercises? What exercises meet these criteria? Here are the 6 exercises I use most frequently with my clients who are seniors. One great exercise is one-legged deadlifts. One-legged deadlifts work the muscles of the glutes, that's your butt muscles, also your hamstrings and your lower back. And the reason that's a good exercise is it teaches you to pick up stuff off the floor. Also, lots of our senior clients complain that they have a hard time putting on their socks or tying their shoes because they feel so tight. This is the exercise that, although it's not a stretch, it loosens you up better than stretching in the long term, and it makes it last longer. That's one great exercise to do. Another good exercise is an overhead press. An overhead press works the muscles of the shoulders and the triceps. And this helps you put away things like soup cans, potato sacks onto high cupboards. It covers those same muscles. Another great exercise is lat pull-downs. Lat pull-downs work the muscles of the biceps as well as the most obvious, the lats, which is the big, wide, broad back muscle. Another great exercise is squats. Lots of our clients who are seniors often complain that they have a hard time getting out of their couch, the toilet, the chair, getting out of their car seat, going up the stairs, and that's because their thigh muscles are too weak. Well, squats work and strengthen those thigh muscles. So the 2 dominant muscles worked in the squats are the quads, the front of the thighs, and the glutes, your butt muscles. Very, very important. Another great exercise for seniors to do is seated rows. Seated rows work the muscles of the upper forearm and the mid-back. A lot of seniors want to improve their posture, and because this strengthens the mid-back muscles, this also improves posture. And a final exercise that I'll mention here is some version of an incline push-up. Maybe push-ups on the floor are too difficult for you. Maybe you just don't have the upper body strength yet for that. So for now, just try putting your hands on the wall and pushing away from the wall. As you get stronger, you can go lower. Instead of pushing off the wall, you can go onto your kitchen counter. You can go on your kitchen table. You can go on a coffee table as you get stronger. Now, there are certain common barriers to seniors exercising. One common barrier is the fear of injuries. And no doubt about it, that's a legitimate fear. If you want to alleviate this fear, watch enough videos, or better yet, if it's within your budget, hire a professional to teach you the right technique for your body type. So that's one common barrier. Another common barrier is the lack of motivation, and that's understandable, especially if you've done things in the past like tennis or golf that are interesting, you're in the game. Strength training could be boring. So how do you keep your motivation? There is one word they have to say: progress. If you're progressing, you're going to be motivated. If you're not progressing, if you're stagnant, or worse yet, you're regressing, well, that's not motivating. That's where progression comes in. Again, you want to make something ever so slightly harder the next time you do it, whether that's one more pound, one more rep, etc. So lack of motivation could be beat by building progression into your plan. But there are other strategies. One strategy is to have an accountability partner. That accountability partner could be your spouse, could be your child, could be your friend, could be a random person that you meet in the gym. Or my very, very biased suggestion, a personal trainer, because they give you A, the motivation, but also B, the effectiveness. Your spouse, your child, your other person in the gym might not give you the effectiveness side of things, but they can give you the motivation, the accountability. And another common barrier is health conditions. Understandably, if you have osteoporosis or arthritis or some other kind of joint pain or high blood pressure, you might be worried about, can you exercise if you have these conditions? Most of the time, the answer is yes, and it's actually very beneficial for you, but you just have to make adjustments for those conditions. Either look it up online on YouTube or hire a professional who specializes in seniors to help you do that, especially a personal trainer. If you like this information, I have a special newsletter with both videos and articles that you don't find on YouTube. If you click on the other link in the description below, you'll be able to subscribe to that newsletter, and you always have the option of unsubscribing. Thank you, and goodbye.